have real impact on health. Housing and employment are really critical social determinants of health because they are foundational needs. And we cannot expect stable health outcomes if people's first priority is where they're going to sleep tonight or how they're going to pay their bills, or if they're hungry and really in need. For a health system to provide whole person healthcare, it has to tackle the non-healthcare needs as well. This is exactly what we mean by foundational community supports. And now I'm going to have Kate take us into more about foundational community supports.
Good afternoon, everyone. This is Kate Faber with the Healthcare Authority. I'm going to talk us through what foundational community supports is. So foundational community support includes two brand new Medicaid health insurance benefits. These are independent benefits, and people who are eligible can enroll in one or the other or both at the same time. So one is a supported employment services Medicaid health insurance benefit, and the second is a Medicaid supportive housing services Medicaid benefit. I'm going to talk more in a moment about what is included in both of these benefits, but I want to start with just a quick, important foundational overview of what's included and what is not included. Because Medicaid is a health insurance program, it can only pay for services. So services that are necessary or that will benefit someone's health. Because it's health insurance, it cannot pay for things like rental subsidies, capital resources to build affordable housing, or tangible employment supports like transportation assistance, clothing for a job, education courses to get training for employment. However, the services can be braided and paired with these other types of supports that are necessary to help people access and keep a home and a job. Next slide, please. Stepping back, I'm going to review how foundational community supports is organized. So starting at the top in the orange box, foundational community supports is a Medicaid program. That means it's a health insurance benefit that's jointly funded and administered by the federal government and the state government through the Washington State Healthcare Authority. The Healthcare Authority provides oversight of the program through our Division of Behavioral Health and Recovery and Policy Division. We also partner very, very closely with the DSHS Aging and Long-Term Support Administration to help providers and people who have long-term care service needs access the resources they need to be healthy. The Healthcare Authority has a contract with Amerigroup Washington. Amerigroup Washington is one of Washington State's managed care plans. However, their role as a third-party administrator of foundational community support is completely separate from their book of business as a managed care organization. This is a really important point, and a frequent question we get is, can somebody who receives their Medicaid coverage through another managed care plan like United or Community Health Plan of Washington or Molina, are they eligible to receive foundational community support? And the answer is absolutely, as long as they meet the health and risk criteria, which we'll review in a moment. So Amerigroup Washington, in their role as the third-party administrator, is the single entity that community-based providers, employment providers, and housing service providers contract with, and that's who organizations work with to get people authorized to receive services, to get paid for delivering services, and to manage those individual provider contracts. One of the strengths of foundational community supports is that we have contracts with a really wide range of different types of providers, including community-based organizations, social service organizations, healthcare providers like large hospital systems and federally qualified health centers, community behavioral health agencies, long-term service and support providers, and tribal providers. So there are numerous pathways for eligible providers to become contracted to deliver and get paid for providing foundational community support services. Next slide, please. I'm going to step back for a moment from foundational community support to address housing resources. This is because in Washington State right now, we have a severe shortage of affordable housing resources. And when we do foundational community support presentations, we get a lot of questions of, okay, we have these great supportive housing services available. How do we pair them with housing resources to help people access rental assistance or affordable housing to live inside? And I'm going to review a couple of quick resources that you can reference. And there are hyperlinks in these slide decks that you can access when we post this presentation online. Starting with emergency housing assistance resources, there's a Washington 211 hotline. That's a free hotline. Anyone in the state can call 211. An operator will help direct that person to emergency housing provider in their local community. The Department of Commerce maintains a list of coordinated entry organizations, and these are hubs in every single community across Washington that administer emergency housing assistance and rental assistance for people who are currently homeless or are at risk of experiencing homelessness. And the link here has a list of coordinated entry providers that people can call in any community in Washington to access help. We also have some other housing resources, and I want to acknowledge that there aren't enough resources available right now for people who are homeless who need housing support, and that's something the state is working to address. Starting in January, the state legislature will convene for the 2019 state legislative session, and there are a number of housing proposals the legislature will consider, and will make a decision to fund or to not fund the next few months. Our partners at the Department of Commerce have forwarded a proposal to create 1,000 new rental subsidies for people who are experiencing homelessness, with the intent that those subsidies be paired with foundational community support services so people can get the help that they need to access housing and stay stably housed. The advocacy community is forwarding a number of other housing proposals, both rental assistance and capital proposals that the legislature will be considering. So this will be something that everybody will want to be watching between January and April. The DBHR, or Division of Behavioral Health and Recovery, has recently launched a new website called Pathways to Housing, which is a one-stop shop for all sorts of housing resources, whether you're looking for sources of rental assistance, resources for veterans, legal resources. This is a great place to start. DSHS offers a number of cash assistance programs that can support people's income and help them afford rent. There are community service offices located all over Washington that you can check out to see if you qualify or if somebody you're working with qualifies for support. And the Housing and Urban Development Agency at the federal level operates a number of rental assistance programs. And HUD just invested about $300 million nationally in a new type of rental assistance voucher called mainstream vouchers. And these are perfect vouchers that can be paired with foundational community supports to cover people's rental assistance, and foundational community supports can pay for the services. I recommend that you reach out to your local housing authority, which you can find through this link, to see if your local housing authority has received any new mainstream vouchers, and to see if you can develop a partnership to pair foundational community support with these resources. The Department of Commerce also has a new landlord mitigation program that provides incentives for private landlords to rent to people who use a public subsidy to help pay their rent. And this is paired with a new source of income discrimination law that makes it illegal for landlords to deny people housing solely because of how they pay their rent. Finally, if you're working with anyone who's experiencing legal barriers to housing, there's a number of free legal resources to help tenants living on lower incomes. Next slide. Back to foundational community support. What new services are covered through these benefits? I'm not going to go through every single benefit, but I do want to let you know we have a link at the very end of this presentation where providers can access the provider manual that has a very detailed list of every single service that's authorized through these new Medicaid benefits. In summary, the supportive housing service benefit includes pre-tenancy services to help people search for housing and apply for housing, and tenancy sustaining services, so ongoing services that are provided to help somebody stay stably housed for the long term and manage any crises or problems that might become a barrier to them keeping their housing. Next slide, please. The supported employment benefit provides pre-employment services, meaning services that help people immediately apply for jobs, search for jobs, and develop goals for jobs. Once somebody gets a job, supported employment services can continue and help support somebody in maintaining that job over the long term. Again, a detailed list of every single service that's authorized through these benefits is included in the provider manual, which is linked at the end of this presentation. Next slide, please. So who is eligible to receive foundational community supports benefits? These benefits are available to a subset of people who are enrolled in Medicaid who have the greatest and most immediate social and health needs. We're working to prioritize serving people who, but for foundational community support, would have a very, very difficult time finding and keeping a job or finding and keeping a home. So there's 3 eligibility criteria someone has to meet. First, because it's a Medicaid program, the person has to be enrolled in Medicaid. If you're working with somebody who's eligible for Medicaid but not yet enrolled, we can do that very, very quickly as a healthcare authority, so please reach out. That should not be a reason somebody doesn't enroll in foundational community supports. For the housing benefit, you must be 18 or older. For the employment benefit, you must be 16 or older. Criteria number 3 is you must have complex needs. So you must have one medical need, and that can be a mental health condition, a substance use condition, if you need assistance with long-term supports, or if you have a complex physical need. You also must meet 1 risk criteria. I'll talk a little bit more about what risk criteria are available. Again, just for all of these, you just need to meet 1 of these criteria. So just 1 mental health condition or 1 substance use disorder, not necessarily 1 of each. Next slide, please. So this slide provides more detail about potential eligible risk criteria that someone can have to be eligible for foundational community supports. On the left are criteria for housing, and on the right are criteria for supported employment. Note that someone just needs to meet 1 of these, not each of these. So I'm not going to review these in detail, but you can see there's quite a few different venues for people to become eligible who need help to stay stably housed or access stable employment. Next slide, please. All right, so now you have an idea of what foundational community supports is. How do you refer someone, or how do you refer yourself to these services if you need help finding or keeping a home or a job? The bottom line is that anyone can refer someone to be assessed for foundational community supports. That includes people who are seeking services, family members, clinical providers, social service providers, literally anyone. There's 1 right door to being assessed, and that's through contacting the AmeriGroup third-party administrator. There's 3 ways you can do this. You can submit a referral form directly to AmeriGroup, and there's a shortened link right there of where you can find that very short referral form. You can email AmeriGroup and let them know that you're working with someone or you yourself are interested in being assessed for eligibility, or you can call AmeriGroup, and their phone number and business hours are listed on this slide. Next slide, please. Last of all, I'm going to provide a quick overview for providers of how the payment rates or reimbursement rates are structured. So quickly, for the employment benefit, services are structured in 15-minute units of service. So this is fee for service. This is different than a lot of employment and housing providers of how they've been paid in the past. typically, social service providers have traditionally gotten a grant. The grants, they're able to serve as many people as they can, and then when they run out of resources, they stop providing services. This is a little bit different. With foundational community supports, the provider delivers the service and then gets reimbursed by Amerigroup, the third-party administrator, after they deliver the service. So for employment, services are divided into 15-minute units of service. For every 6-month period of service, a person is authorized for 120 units or 30 hours of employment services. For each unit, 15-minute unit of service, providers can get reimbursed for $25. And then these services are ongoing, so they can be reauthorized as long as someone continues to need employment support to stay employed. So they're time unlimited. If you're working with somebody who has higher needs, there's an exception to the rule process where you can get authorized to deliver more units. Housing benefit is a daily rate, meaning no matter how much time you spend with an individual during a day, you get reimbursed for $105 for that day of service. The housing benefit has 30 days of service authorized for every 6-month period someone is enrolled in foundational community supports. And again, there's no limit to how many times somebody can be reauthorized for service. It's a non-time limited benefit. And the same exception to the rule policy is available. Next slide, please. So how does this pencil out for organizations? This is an equation to give you an idea of how much revenue this might generate for a social service organization or behavioral health organization that is delivering supportive housing and employment. Something to remember, these only include the FCS, Foundational Community Supports package of services. This does not include behavioral health services or clinical health services, just the housing and employment services. These examples show that for an average service utilization that the state predicts that for a caseload of 1 to 20 people, that the housing benefit could generate $126,000 per year, and for the employment benefit, $120,000 per year. This should be enough to cover your housing or employment provider, their benefits, and any billing or administration or supervision costs that you incur to deliver these benefits, and transportation costs for your staff to go to the community to meet with participants. We have a lot of resources for providers who've never worked with Medicaid before to learn about how to incorporate this into your book of business. We can include that in our follow-up materials. Now I'll turn it over to Melody.
Thanks, Kate. Thanks, Sue. There has been so many early successes with the foundational community supports. It's so amazing that these services just launched in January of 2018. And not only did we launch foundational community supports, but the Division of Behavioral Health and Recovery became part of the Healthcare Authority in July 2018. And so we're so excited to be really part of the Healthcare Authority and really being able to implement whole person care on behalf of individuals with behavioral health conditions. You know, I'm a very visual person, and I wanted to kind of talk a little bit about the next steps around foundational community supports and our early successes, because if you're anything like me and you like Sudoku, you have to think about the vertical and horizontal as well as within the box thinking around how to implement these new services. So if you hit the button for a slide, it should advance. You know, with the 1115 foundational community supports, this is a Medicaid benefit, as Kate was talking about, and we have Medicaid requirements that we have to meet in terms of how we document the medical necessity and how the services are delivered. So that's one of our requirements. We also have to think about implementing evidence-based practices and the quality of the services that we're providing. And so both supportive housing and supported employment are evidence-based practices at the federal level from the SAMHSA, the Substance Abuse Mental Health Services Administration. Within Washington and the Washington Institute for Public Policy, they are on the list of research-based practices. And so, you know, it's really important that we continue to focus on a continuous quality improvement process to make sure that the services that we're providing are also quality services. And we need to think about outcomes. There's nothing more tangible than an outcome of helping a person get a job and getting a home. And so it's really important that we track those outcomes, and we are looking at those outcomes from our providers on a monthly basis. And we need to think about sustainability after the end of the 5-year Medicaid transformation demonstration. Next slide. So in this short period of 10 months, our providers, AmeriGroup, our partners have just done an amazing job of getting the word out there, and we have 22 people currently enrolled in supportive housing and supported employment. 2,200, I'm sorry, what did I say? 22. Thank you. We have 723 individuals enrolled in supportive housing and 1,377 enrolled in supported employment. And it is possible for people to be enrolled in both services. So we have 99 individuals enrolled in both supportive housing and supported employment services. You know, as a requirement from the CMS is that we have to have these services available statewide. And so we have to have provider capacity available all around the state. And so right now we have, AmeriGroup has 85 agencies currently under contract. And those 85 agencies represent 258 service locations across the state. We still have some work to do. We still want to increase our capacity. And so there's still plenty of room for agencies to become providers of AmeriGroup. And those locations for supportive housing are 30 distinct locations that are just providing supportive housing services, 83 distinct locations that are providing supported employment, but 145 locations that are able to provide both supportive housing and or supported employment services. We also are looking at, you know, continuing to increase our number of individuals that can be provided under supported employment and supportive housing services. So, we are on a regular basis getting new individuals enrolled in services. So this will flux a little bit as people, that authorization period for 6 months, we'll see kind of what we call churn of people coming in and out of the service delivery system. But there's still a lot of room to grow these services in every location in Washington state. Next slide. So who is receiving supported employment and supportive housing services? And as Kate was describing, that these services really are intended to serve some of the most complex individuals, most vulnerable individuals in our state. And so this is some data from research and data analysis as we start looking at who is actually receiving supported employment and supportive housing services. And what we found was that actually of those 2,000 individuals that are receiving supported employment and supportive housing, quite a significant number of them have either received substance use treatment services in the last 12 months or have a substance use treatment need that's been identified through administrative data in the last 24 months. Maybe they presented at an emergency room or are a detox, and so that treatment need is an indicator, but we know that there is a lot of need out there, but it also demonstrates that we're reaching the population that these services are intended to serve. On the mental health side, that 79% of individuals had received mental health services in the last 12 months, with 95% of them having a mental health treatment need in the last 24 months. And that's under the supported employment services. And you can see the same indicators for supportive housing, that 32% of the individuals enrolled had received substance use treatment services in the last month, but 72% had a treatment need. And we'll continue to look at how we can help our supportive housing and supported employment service programs access treatment services on behalf of individuals, and that will be some of the work that we'll focus on this next year. For supportive housing, you can also see that 78% of the individuals received mental health services in the last 12 months, with 96% of individuals in supportive housing services having a treatment need in the last 12 months, and 24 months, excuse me. Next slide. In addition to Duff's story, we're also hearing a lot of amazing stories from around our state, including a story about James. And of course, we're using a name that's not violating confidentiality. And so Roxana from the Opportunity Council up in Bellingham provided this amazing story about James, who because of physical limitations, has lost employment, was not able to maintain employment, and really experienced long periods of unemployment. And we know how not only detrimental it is to people's health that being unemployed for long periods of time, but James also was feeling really hopeless about being able to get back to work because of those long periods of unemployment. And so while Roxana was able to help him explore options, they were also looking at wrapping around supported employment services along with the supportive housing services. And so Roxana was able to go out and develop relationships with employers out in the community. And so she, through that job development effort, learned of had a relationship with a local hardware store. And James was, a little ambivalent, a little nervous at first, but he was, with her support, able to submit his application and aced his product knowledge test, and he was offered the job. And now James is saying he feels like a real person again. He now signs off his emails to her with statements like happily employed, and he wants to keep this job for the next 20 years. Another success story that we heard about was from Melissa Taylor down in Longview. And so we heard about a person who really was experiencing kidney failure, some really significant chronic health conditions. And in addition to her chronic health conditions, she also was experiencing homelessness. And without a home base from which to seek treatment, she was living in the hospital for weeks on end and receiving her daily dialysis treatments. And for another month while recuperating from a kidney transplant. So this was a really expensive way to care for a vulnerable person. Through the Lower Columbia Community Action Program and their work under the FCS program, they were able to help Tina move into her own home by combining the FCS pre-tenancy services with state-funded rental resources. And so the FCS services, the supportive housing services, continue to help Tina stay in her home and avoid more costly hospital stays. So not only are we seeing a large number of people wanting these services, but we're seeing some amazing success stories coming out of these services as well. So what's the next year going to bring to us? And so next slide. So we certainly want to continue to expand our provider network to serve participants statewide. We've got contacts out throughout the state, both from the Division of Behavioral Health and Recovery, as well as our system partners through Aging and Long-Term Care Services Administration, to help agencies get connected to AmeriGroup to develop that contractual relationship. And so if you are an agency that's interested, we've got some resources and information to help you take that next step. We also want to focus on the quality of the services. And so we will be looking at implementing a learning collaborative approach to the quality, the continuous quality improvement process for the fidelity to supportive housing and supported employment services. And we know that that's a kind of a costly process to take time away from a fee-for-service contract to focus on quality improvement. And so we do have some incentives that we'll be working with agencies that are providing, particularly on the behavioral health side, because of our funding sources that we have, we can look at this learning collaborative approach to continuous quality improvement around fidelity reviews, as well as helping agencies participate in a fidelity review process so that there's a mutual cross-pollination of learning happening around continuous quality improvement. all of us around the state are already starting to think about how do we sustain these services and making sure that this becomes a permanent Medicaid benefit. And we will be looking at the data as well as those stories to continue to tell the story around the state about the effectiveness of foundational community supports. So these are some of the resources that I wanted to draw everyone's attention to. So for the Division of Behavioral Health and Recovery, we have supportive housing and supported employment trainers. Two trainers that we actually, one housing and employment person located on the east side to help those providers on the east side. We recognize the challenges of providers on the east side and how we want to support and nurture those providers to deliver supportive housing and supported employment. And so we stationed supportive housing trainers and supported employment trainers on the east side. We also have trainers in the west side located here that serve the whole I-5 corridor over to the coast. And so those are our supportive housing and supported employment trainers. Our also partners, also, next slide, have regional resources available to help with supportive housing and supported employment. So these guys are partners in these efforts, and we are all working together to help a whole person approach to foundational community supports, whether you're involved in long-term care services, mental health services, substance use services, or chronic health services, or have chronic health conditions. Next slide. And so I'm going to hand it back to Sue.
Great. So I do want to just give a huge shout out to the state of Washington and the team members here today. This is really groundbreaking work here in Washington and in the nation. And to create this sort of monumental shift about thinking more broadly than just traditional medical services is really remarkable. Building in the right kinds of movement towards true health and well-being will get us wiser use of our dollars and will help with the over-medicalization that's gone on far too long in the U.S. Kind of health system. And I really want to applaud the efforts that all of you here in the room and around the state are making. So at this point, what I'd like to do is open it up for questions from our audience and see if we've got any questions coming in. Kennedy, do you want to share with us what's coming across the wire?
Sure, absolutely. We've already got a few questions coming in, and again, feel free to use that Q&A panel to ask your questions. One of the questions that came in was, does somebody need to have a source of income to qualify for services?
This is Kate. I can take that question. Absolutely not. You don't need any income at all to be eligible to receive Medicaid. There is a maximum amount of income that you can have to be eligible for Medicaid, and that's 138% of the federal poverty level. One note on the employment services: as someone gets employed with assistance from foundational community support, one of the services available is benefits planning. So providers can get paid to sit down with somebody and help them understand how becoming employed or working more hours will impact their income and will impact what benefits, including Medicaid health insurance, how that will impact their eligibility. And that allows the participant to make an informed choice about how they want to structure their employment hours, knowing how it will impact the resources that they are eligible for.
This is Melody. I just want to add on one of the hidden gems that we have in Washington State, particularly for folks on SSI or SSDI, is the Healthcare for Workers with Disabilities program, which is our Medicaid buy-in program. And so this is such a tremendous resource for people, particularly if they are experiencing spend downs. So by going back to work, you can actually purchase Medicaid for a premium based on a combination of your earned and unearned income, such as SSDI and your wages. And so it's such a tremendous resource for people to maintain the Medicaid that allows them to receive the treatments and the medications that they may need to sustain employment, but it doesn't, it's not a catch-22. This is such and it's such an underutilized resource that we have. And so certainly the supported employment services can help somebody navigate and learn about programs like the Medicaid buy-in program, the Healthcare for Workers with Disabilities program. I also would like to call out that there's another tool in our tools that we have called the Pathways to Employment site, which is actually a benefits estimator, and it will help individuals and staff understand the impact that working has on somebody's benefits. And so there's also a lot of resources available, and we'll make sure that the Pathways to Employment is also available on the links.
Great, thank you so much. Another question has to do with when the 6-month period is up, how do you reauthorize for supported housing?
This is Kate, I can take that. We recommend that the provider, the foundational community supports provider, at least 4 weeks, ideally before that authorization period ends, submits a reauthorization form to AmeriGroup. The time a provider spends doing that is reimbursable through foundational community supports, and AmeriGroup will check to make sure that individual is still enrolled in Medicaid and still needs supportive housing services or supported employment services to stay employed. One thing to note, a question we get a lot about this is, what if somebody was initially eligible because their risk criterion was that they were chronically homeless? Now that they're stably housed, they don't meet that. Will they be penalized and use or lose their foundational community supports coverage? And the answer is no. We're not penalizing people for successfully becoming housed and successfully becoming employed. And as long as the person still needs and wants support to stay housed and to stay employed, they will be reauthorized by AmeriGroup.
Thank you, Kate. This is a related question. Is there any financial assistance for those seeking housing?
So again, foundational community supports, because it's a Medicaid health insurance program, has some limitations of how it can be used. And one of those limitations is that it can only pay for services. So that slide that we referenced earlier with resources for rental assistance and physical affordable housing, an FCS provider, part of their job is to help somebody search for those resources, access those resources, and then keep those services and those resources over the long term.
Great, thank you. This is a really great question, and I want to open it up to the entire panel. How do you see medical providers or health systems connecting to this work?
Well, I'll start that off. This is Sue, and I have to say, being the newbie to the state and having traveled pretty extensively now, I've seen quite a few of all the medical partners that have begun to create more social workers and behaviorists in the practice settings. And so they're very knowledgeable about the resources that are available in their communities. And so I do hear more about the inventory of resources that are available. I know we always need more housing inventory, but I will also tell you that it really heartens me when I hear from doctors and nurses, social workers, that they know about Catholic Community Services, and they know about Yakka Neighborhood, and they know about DESC and where to refer people to or who to call upon to find the right case managers, to even link people up to these resources. So I do think that as we are creating more of this conversation about more of the well-being arena, that it really is important that our teams learn more about how to create these linkages. And it's really important that we refer back to these slide sets to think about some of the resources that are out in the regions so that we can create these connections. And AmeriGroup certainly is helping with that, but it needs to become more commonplace. We all know in the medical setting to call Quest Lab, or we know the hospitals to call, So we need to stretch our mindset and stretch our thinking about getting these people synced up beyond our human service partners, our social and human service partners, to some of these housing and experts and our employment experts. So that's one way.
This is Melody. I just like to add, I heard a presentation from a doctor once that said, he had, individuals coming into his doctor's office that, just didn't have a lot of hope, no purpose or activities happening, and homeless, facing homelessness. And he said, I would just like to be able to write a prescription to be able to get housing and employment for someone. And that's really what these are. And so it's really, how do we develop the relationships between those doctors' offices and these service providers? It's how do we make sure that discharge planners have information about making referrals to foundational community supports and coordinated entry. And it's really about developing those marriages and those relationships. It's about getting everyone the information about 211 so that they can make those referrals. And it's really about sort of facilitating those partnerships. If we have a doctor's office that maybe isn't comfortable with delivering these services, how do they develop a partnership, maybe with a foundational community support agency that is under contract and can make those warm handoff referrals, or those, be able to write that script to that partner. And so it's really about the relationships that we're working on and really thinking about the whole person.
Thank you. Another question related to the system as a whole. How does the program work with community colleges and workforce centers, and how can we work to expand that?
So it's Melody. So, the Workforce Development Councils and the Workforce Innovation Opportunity Act I think is a tremendous opportunity. As Kate talked about, in what we can deliver under supported employment services, it's the services to help somebody obtain and maintain housing. What we don't have access to is the short-term training programs, the money to buy books and shoes and clothing and tools. And that's really, I think, where the expertise and the partnership that a workforce center or a workforce development council or the Division of Vocational Rehabilitation comes in, is that we can develop those relationships, again, those marriages between the services that they can provide under WIOA, under Wagner-Peiser, or apprenticeships, as well as the expertise that the Division of Vocational Rehabilitation has on just the impact that disability has on employment and employment has on disability. And so we can't duplicate any of those services, but there certainly are a lot of expertise and resources and things that both the workforce centers and the Division of Vocational Rehabilitation can provide that we can't within SCS. And so again, it's all about relationship.
Great, thank you so much. We're going to switch gears a little bit to talk about the foundational community support vendors or providers. Do you have to have a successful housing or employment placement match to be paid?
No, so these services have a pre-tenancy or a pre-housing component. So you can get paid for those services before somebody is employed or before somebody is housed, that are necessary to help them access those placements. We do expect that that's the end goal, is finding somebody permanent housing and finding somebody a job. But these aren't outcome-based payments.
Great, thank you. Another question about the providers. What types of providers are the Medicaid FCS providers? Are they HIPAA-covered entities? Is AmeriGroup HIPAA-covered, or is the provider a business associate of AmeriGroup?
This is Kate. I can start. So this is a Medicaid health insurance program. So it is the entire program is covered by HIPAA, including the healthcare authority, AmeriGroup, and that's a requirement of every single contracted foundational community support provider. In terms of who providers are, There's a wide variety of eligible provider types who, again, must be HIPAA covered and HIPAA compliant in how they handle personal health information. Those include traditional social service organizations, healthcare organizations like hospital systems, federally qualified health centers, tribal health departments, behavioral health providers. So a wide variety, but everyone is falls under HIPAA.
Great, thank you. And as far as the housing and employment offices, where are they located? Are they in behavioral health treatment centers, FQHCs, hospitals?
This is Kate again. I'll start and feel free to jump in, anyone else. So these services are unique because they're community-based. So typically somebody doesn't come into an office to receive services. The provider goes out into a community where somebody lives, where they work, to a community center to deliver services. And this is a best practice to really support community integration.
This Melody, if we could go back to the slide that has the flow chart of how the services, and I think what I think I heard in the question as well is who can provide these services. And it really, one of the things that we're demonstrating is that these services can be provided by quite a wide range of agencies. And so whether that is a community action program, a healthcare provider, an FQHC, a federally qualified health center, a licensed community behavioral health agency, a contracted agency under the Aging and Long-Term Care Services, or a tribal program, a tribal health center. So we intentionally, as part of the demonstration, wanted to show that non-traditional providers could provide this insurance-based program under the Medicaid auspices, because we think that that's really an important part of whole person care, is that it's all about agencies working collaboratively to help support a person.
So this is Sue, and if I could just quote something I heard from Kate that I thought was really extraordinarily visionary. When you think about the broad swatch of people that are listed there in the dark blue section, when you look at those FCS providers, the potentiality of all 270 of you that are listening in, all of you that would embrace this, and if you think about all of the Department of Commerce folks that are working on building up housing inventory, all the affordable housing opportunities where people are really leaning in to try to build up stock. We really have, as a state, within our reach to solve homelessness because we have bricks and mortar in inventory, capacity being built up, and we have service providers. So it's no longer an either or. We have inventory and services in this state. So it's up to all of us to really lift on this issue, because we can, in this state, end homelessness in the next decade. So it's our call to action. We've built this in this waiver. We can do this as we lean in. It's hard work, but we can do this together.
Thank you, Sue. Unfortunately, we've run out of time. We will follow up with the questions that we didn't get to in our follow-up email, along with some resources, a copy of the slides, and a recording, a link to the video of Duff. Again, thank you all for joining us today, and have a great afternoon.